up to the podium and introduce yourself. Please state your name and any organization you represent for the record.
Good morning. My name is Kristen Ogden, and I'm the co-founder of a small advocacy group called Families for Intractable Pain Relief. I'm not a medical professional or a scientist. I am, however, the caregiver of my beloved husband of 46 years. I have been advocating for him for at least the past 20 and more fully engaged in advocacy since I retired from federal service in 2014 with 36 years of service. I'm a 1975 graduate of the College of William and Mary, and at the time of my retirement, I was serving as Director of Strategic Planning and Performance Management for the Defense Commissary Agency. Families for Intractable Pain Relief, as I said, is a small group. Our goals specifically are to raise awareness of what we are calling severe, constant, intractable pain and the challenges faced by those who suffer it, and we advocate for access to whatever therapies are needed to properly care for these individuals. We support the appropriate prescribing of opioids at any dose by qualified physicians as a last resort treatment to relieve the severe intractable pain of any patient for whom such dose is deemed necessary to stabilize function and bring quality of life. I put this slide up here because we have over the years been somewhat frustrated that none of the definitions adopted by the federal government really quite seem to capture the type of pain experienced by the folks who are the members of our group. The pain does not relapse as indicated in the recent definition adopted by the task force. We're talking about excruciating, constant pain without remissions. Not curable, causes a lot of very adverse effects if not adequately treated. I've asked people often to think about what would your life be like if you had a constant experience of the worst pain that you can imagine. Every minute, every day, every hour, every week, with no remissions. That is what life for my husband and many other people has been like without adequate pain care. These are the characteristics of severe intractable pain as we describe it. Causes are twofold. It generally requires one of the few diseases up here on this slide, to the best of our knowledge at this point in time. Adhesive arachnoiditis, RSD or CRPS, various post-viral and other neuropathies and encephalopathies, brain injury, and now also genetic connective tissue disorders such as Ehlers-Danlos and others. Why am I here personally today? To share the experiences and outcomes of many of our patient members who have been successfully treated with high doses and in some cases ultra-high doses of opioids for many years. Many lives have been saved. These patients have achieved good pain control, improved function, and far better quality of life. And there is a wide range of therapeutic doses. Many got good relief in the 100 to 200 milligram range. Some have fared very well on dosages in the 2,000 to 3,000, and that's where my husband falls. And it's very important that he continue to have access to his medications. At the moment, he doesn't, and I'll talk about that in a few minutes. Most of our members, although not all, were members of Dr. Forrest Tennant in over 40 years of practice as an intractable pain specialist. He had no instances of overdoses. No patients became addicted after starting their regimen. No instances of patients harmed. So in terms of the question for which this meeting was called, the clinical utility of high-dose opioids, from our point of view, medical management of intractable pain can enable a patient's overall condition to be stabilized while underlying causes are identified and treatments are attempted. That can be accomplished without undue risk of adverse outcomes such as overdose, addiction, or death. Failure to treat it may lead to these adverse outcomes and early death. Compassionate relief of this kind of constant severe pain is certainly the right thing to do.